All right, so let's get settled in today for our conversation. I want to go ahead and if you want to go to the next screen, Allie, I want to start off by taking the opportunity to thank our participating host sites across Wisconsin that have folks gathered at community locations to hear today's presentation and take part in the discussions. So we have folks from Green Bay and Janesville, La Crosse, Mayville, Madison, and Watertown, and they are paving the way to providing access to resources and support throughout Wisconsin. Next slide, Ellie. So let's get settled in for today's conversation. And before we begin, I'd like to take care of a few housekeeping items. Our program is being recorded and it will be housed on our Healthy Living with MCI webpage. We edit the video prior to posting it, and we remove everybody's identifiable information. So if any of you have concerns about that, please know that we're going to take all of that out. We ask that you mute your microphones during the presentation, and we will have a time for Q&A throughout the presentation today with our guest speaker and with Dr. Chin, who's going to be joining us a little bit later in the program today. So feel free to add your questions to the chat. Today's program runs until 11:30, and we will have a scheduled break in the midpoint of the presentation. So I'd like to take this opportunity to introduce myself. I'm Jennifer McAllister. I'm the Community and Partnerships Program Manager with the Wisconsin Alzheimer's Disease Research Center. And today you are taking part in one of our signature education programs called Healthy Living with Mild Cognitive Impairment. And so I'm going to take the opportunity to introduce our guest speaker, who is Dr. Cynthia Carlsson. Dr. Carlsson is the director of the Wisconsin Alzheimer's Institute. She's a geriatrician at the William S. Middleton Memorial Veterans Hospital in Madison, Wisconsin, where she treats veterans with dementia and memory issues. Dr. Carlsson is a faculty member of the Division of Geriatrics and Gerontology within the Department of Medicine and a Lewis A. Holland Senior Endowed Professor in Alzheimer's disease. She serves as the clinical core leader and a co-leader for the biomarker core in the Wisconsin Alzheimer's Disease Research Center, and she is a recipient of the University of Wisconsin Vilas Distinguished Achievement Professorship. She's a member of the National Institutes of Health, National Institute on Aging Alzheimer's Disease Centers, Clinical Core Research Review Committees. Dr. Carlsson's research focuses on the effects of vascular risk factors and their treatment on cognition and biomarkers for Alzheimer's disease in persons at risk for dementia. Her research lab is also a site for the AHEAD study, a research study that aims to help prevent Alzheimer's disease by enrolling participants as young as 55 and using a tailored dosing approach. Dr. Carlsson is a returning presenter to the Healthy Living with MCI Education series, and her talk for today is titled, Heart Health is Brain Health, Reducing Vascular Risk Factors for a Healthier Mind. So welcome, Dr. Carlsson, and thank you for being here with us today. We're so glad to have you with us and to share information on the connections of vascular health and cognitive health. So we're going to stop sharing our screen and we're going to hand it off to you.
First, I just want to thank you, Jen, for inviting me to speak today. Thank you to Allison and Ben for helping with this session. And thanks to all of you for being here today. So again, with our Alzheimer's Center and our research, not only do we try to share back with you things we're learning, but the questions that you ask and the insights you have really shape what things we study, what things we bring back to our clinics. So I really enjoy these presentations and chance to interact with you all. So I'll do some education here, and we'll talk about some of these factors, how heart health impacts brain health. But again, I'm really thankful there's a lot of time built in for Q&A so that we can hear from you what your questions are. So thank you again for taking time to be here with us today. And it's nice to see familiar faces and names of people, some who've been there at our event earlier this week, and people have known from our studies and also and from clinics. So glad to have everyone on the call today. So I'm going to share my screen and we'll go through some slides, and then after a little while, we'll take our break. So is that the correct view, Jen? That looks right. After a little while, we'll take our break and get our stretch. And maybe by that point, you'll want to do some steps. So the person who is asking for 7K to 10K steps, maybe you'll have to run around the room for a little bit during our stretch break after we talk a little bit. So again, I'll be talking about heart health as brain health, so reducing vascular risk factors for a healthier mind. And so as Jen mentioned, I am a geriatrician, so I'm a physician trained in geriatrics. So one of my main interests was, how can we, what are some things we can do to prevent dementia or protect our minds? And so a lot of my research and has gone into kind of studying this. And so hopefully we'll be able to share back some things we found here, but also what other researchers are finding too. So today we'll talk about how blood vessel disease and Alzheimer's disease interact in the brain. So this will be kind of the first section before our stretch, and then for our break. And in the middle, the last 2 points, thinking about, well, how can we target these therapies to help protect our brain? And then how do we individually take some steps to improve our vascular and brain health? So kind of picking up on the question that Jen asked as our icebreaker, what are some goals we have for ourselves? So this slide shows some facts that a lot of us talk about a lot, is that the number of people who are living with Alzheimer's disease in our country is increasing. And part of that is good reasons, because we're living longer. Our other risk factors and our cardiovascular risk and treatments for cancers and other things are helping us live longer. But then we really need to try to prevent Alzheimer's disease, because as you can see, the number of people with Alzheimer's, and I'll use my pointer here, is expected to continue to increase. And part of that is because you can see this blue line is, as we're living longer into our mid-80s, is associated with aging. So we're expected to have more cases of Alzheimer's disease because we're living longer, and age is a risk factor for Alzheimer's. So and these are the numbers of people. So these are the millions of people with Alzheimer's. But if you look at what proportion of us are expected to have Alzheimer's dementia as we get older. So, if I'm in my late 60s, early 70s, again, and can you see my pointer okay, Jen? Okay. So again, we're in our 60s and 70s, the chances of us having a dementia due to Alzheimer's is a lot lower than when we get into our 80s. And it's also different by which racial ethnic group we're in. So persons who are from African-American background or Hispanic background have a higher prevalence of dementia due to Alzheimer's. But again, a lot of these may be also reversible factors, things we call social determinants of health, stress, access to resources, and some other factors as well. So we're trying to tease apart, why is it that different communities have higher or lower rates of Alzheimer's disease? When we look at risk factors for Alzheimer's, so again, I've mentioned that age is a risk factor for Alzheimer's, and we don't know exactly what that means. Is it that we have more wear and tear in our bodies from blood vessel risk factors or other things, or exposures to things? We're trying to sort that out. If we have a family history of Alzheimer's disease, that increases our risk. And there's a genetic risk that many people probably have heard about called the ApoE4 allele. I think some of our questions even submitted before this session talked about people receiving their ApoE genotype. So genotype is just a measure of what kind of gene you have along these lines. And so ApoE4 is a gene that codes for a protein that's related to cholesterol. That's why it has the word lipoprotein in there, lipid. in there. And what it does is it's tied somehow to some of the protein buildups in the brain. So the amyloid that gets built up in the brain, that it's not as effective when it's this one type called ApoE4. So that's one of the genetic risks, but it's not like the kind we think of where if you get a gene, you're going to get that disease. So it modifies our risk to some extent. But if we have an ApoE4 allele or two of them,
I don't have the attention span.
it's higher,
Yes.
but it's our risk is higher, but it's not doesn't mean for sure we're going to get it. So there's things we can do to help protect ourselves. And that's where it comes into these risk factors. So these risk factors shown here are very familiar to us. So high cholesterol, high blood pressure, obesity, diabetes, and physical inactivity. These are things we can do something about. And so that's encouraging because, again, I know we can't change our parents or our genes or aging, but again, we can do something about these other factors. That's what we'll try to talk about today. So we've talked about how common Alzheimer's dementia is and how common it is in, like, depending on what age we are. So how common are these blood vessel risk factors in American adults? So there's been a study where they take all the predictions and they project out what do we expect how common these different risk factors will be over the coming decades. So this one study was put out by the American Heart Association, and they estimated between 2020 and 2050. So if you look here, this is 2020 at the baseline and all the way out through 2050, they estimated how these blood vessel risk factors will change. So let's start with the good news. They expect high cholesterol levels to drop over time. And this isn't even related to treating with high cholesterol, but they think probably diet changes that people are making are improving cholesterol levels, although because they're reducing fats, trans fats, and some of these other things that some of them have been outlawed, people are taking in more carbohydrates and sugars and things that contributing to diabetes and obesity. So we're gonna have to, so hopefully there's some good news with this, but we got to make sure the other ones come down too. So that's the good news. Cholesterol is expected to go down over time because we're making diet changes. But the number of us with high blood pressure, you can see this green line is expected to stay high and increase over time. And again, this is percentage. So this isn't even just the absolute number of people. This is a percentage of us who are adults in the US are expected to have more high blood pressure, more obesity, and more diabetes. So these are things we can do something about. So I'd like to challenge all of us to let's prove these trends wrong and take some action on this. So what these pictures show now are how do they expect these blood pressures to, or these blood vessel risk factors to change in different age groups. So for example, the paired bars down here show what's the percentage of people with a certain condition in 2020. And then the paired bar to the right for each set is what's expected in 2025. So for example, people who are, let's go over here, since more of us are probably in this range, the 65 to 79. So they expect that, again, right now, about 75% of people here have high blood pressure, and it's expected to increase to about 80% of us with high blood pressure by 2050. So again, and then these red lines show like the absolute numbers, which ties with this side of the picture. But you can see for most age groups, even for younger adults, 20 to 44, they expect that the number of people with those conditions will increase over time. So you can see those trends with high blood pressure, and then over here with diabetes. And again, the good trend is with this high cholesterol. You can see that those numbers in different groups are expected to decrease. And then once we get into our 80s, sometimes things kind of change because the people who've lived longer tend to have better like vascular risk factors. So sometimes those numbers are a little bit different than the other groups. But you can see they've looked at these expectations for obesity, for sleep, physical activity. So again, these are all things we can do something about and hopefully prove some of these trends wrong. So how do these blood vessel risk factors interact with the changes we know that contribute to mild cognitive impairment and dementia due to Alzheimer's disease? So first, let's take a step back and think about how do we detect and define dementia due to Alzheimer's disease. So the picture on the left is my grandmother, Margaret Lucinda June Lutz McDonald. And she had in her early 70s developed dementia that they thought was from Alzheimer's disease. Looking back now, she died in the mid-80s. Looking back now, I think she probably had frontotemporal dementia, which is a different kind of buildup in the brain. So when I see patients in clinic, I see people like my grandmother coming in with memory complaints. But then to the right, we see, well, what are the brain changes going on in that person's brain that are causing those changes and how they're able to remember? So, when my grandmother would forget how to make spaghetti and put mayo in there instead, or she'd forget how to make her famous chocolate chip cookies. Those changes, again, were caused by something going on in her brain. And so a lot of times we have to try to piece together what are we noticing in the person and then try to guess what's going on in their brain. And so that's what we'll talk about next. So just so we're all on the same page, again, when I see someone in the clinic, so it's my grandmother came into my clinic, I would have to ask her questions and clarify what was your baseline. So I'd want to find out, okay, she was a French teacher, was really good at cooking and all her strengths, and then kind of see, are these memory changes affecting your day-to-day function? So for her, she went from being a good cook to making lots of mistakes with cooking. It was a challenge for her. And so we'd ask her questions about that. I would also ask and make sure that she didn't have, let's say she had started a medicine that makes people confused. I'd want to make sure she wasn't on any medicines like that or sick with like a pneumonia. And then I'd also do some thinking tests in clinic. So sometimes it's remembering a list of words or a story. And so I'd piece together what showed up on those thinking tests with what she told me or her family told me about how she was doing. So again, to have a dementia diagnosis, and I'm going over this because a lot of us still get confused. How is dementia different than Alzheimer's? Dementia is what we see in the person. So their thinking abilities have changed. It's affecting their day-to-day function. And it has to be at least a couple of thinking abilities. So it's not just memory. It can be memory and how quick someone thinks, called executive function, or memory and language, or memory and picture skills. So again, it can be a combination, but usually memory's affected in the disease we know of as Alzheimer's disease. So again, you can see here, there's nothing about protein buildups or anything else here. This is just what we're seeing in the person who's in front of us. So then you get on this picture, what I'm showing is that, again, we have our thinking abilities over here. And then with normal aging, it might take us a little bit longer to learn new information or trouble recalling it, but we'll still, our intelligence actually increases with aging. How we filter better, which information is important, which information is not important. But again, how in the background of this, there's all these, if we're headed towards getting Alzheimer's dementia, there's all this protein buildup in the background in our brains, but how that affects us is different from person to person. And this is going to be important because as we talk about vascular risk factors, sometimes we might have a lot of amyloid buildup in our brain, which we'll talk about soon, which is contributing to Alzheimer's disease. But if we can modify some of the other things layered on top of that, it might kind of shift these memory changes over somewhat. So that's what we're trying to do with some of these talks and education and our research is to try to see, can we shift this? So even if we do have amyloid buildup in our brain, can we shift it so that we are thinking better despite that? So once we get memory problems that are showing up on our thinking tests in the clinic, but someone's still functioning well, that's what we say is mild cognitive impairment. So again, this whole series is called Living Well with MCI. So MCI is mild cognitive impairment. So again, once we have trouble keeping up with tasks, so making lists and using GPS, and those things aren't working as well anymore, maybe you have to have somebody help us, that's when we say that something's progressed to a dementia. So by the time we see someone in clinic with memory problems, they probably have quite a bit of brain changes. So then we have to see how can we best manage those brain changes and try to protect people's thinking ability so they can live healthy lives despite those brain changes. And so when we talk about these brain changes, which I'll outline next, you can see on this picture here, if we look close up, There's the nerve cells in the brain, and then the tissue around the nerve cells in the brain. And oops, my light just went out for my saving energy. I wave my arms around here. It's giving me some exercise to make sure I don't get too sedentary there. That's good.
That happens here too.
I thought that would happen at some point. All right. So, so again, with these pictures that shows that these are the nerve cells embedded in the brain tissue, and outside of the nerve cells with Alzheimer's disease, they build up these plaques that are made up of a protein called amyloid. And then inside the nerve cells or the neurons, we build up, there's a protein called tau that can build up inside the nerve cells and cause damage in the brain. So that you hear about amyloid plaques and neurofibrillary tangles, or plaques and tangles. One thing I always like to clarify, because we're going to also talk about plaques in our arteries, is that plaques is just a medical term for like a sticky deposit. So we can have plaques in our teeth that can cause tooth decay. We can have plaques in our brain made of, amyloid. We can have plaques in our arteries made up of cholesterol and other changes. So again, that's why that term plaques is used in different contexts. So if we look up close at somebody who has Alzheimer's disease, I'm going to start with this picture on the left. So the picture on the left is a front section through the brain, as if you're looking straight on someone's head. And what this shows is that the tissue here is nice and plump, and you can see that this area that's a little bit darker on the outside, that is what we call the gray cells, or and if any of you are Hercule Poirot fans, Agatha Christie fans, he was talking about little gray cells that he had working. So, and again, where the little gray cells are is really where these neurons are. So the body of these neurons, the nerve cells in the brain, are based there. And then all that white material in between is where the connection tracks are. And we'll talk about that. And I think somebody had a question ahead of time about what are white matter changes, and so in the brain. So we'll talk about those too. But you can see this picture, and then down below is an MRI scan of what that looks like on MRI. So you can see that the tissue is nice and plump. This part of the brain called the hippocampus is nice and full. Whereas if we develop Alzheimer's disease, there's some shrinkage of the brain that's called atrophy. And all of us have a little bit of shrinkage of our brain as we get older, just part of aging. But with Alzheimer's disease, again, you have this buildup where you have the amyloid plaques and the tau tangles. And so you can see that there's shrinkage on the MRI scan below. So I just want to get that so that we're all on the same page with that. And so there are different causes of mild cognitive impairment and dementia. And I'm sure you've gone over this in these sessions before, but again, when we talk about, and this is why dementia and Alzheimer's disease are not the same thing, is because you can have different conditions in the brain causing mild cognitive impairment or dementia. So you can have Alzheimer's disease brain changes, and that's what we just talked about. So these plaques and tangles, or amyloid and tau, that's that protein buildup there. Lewy body dementia is another one that looks a little bit like Parkinson's. That can have another protein buildup called alpha-synuclein. So that's one that our research team is studying. And you can have vascular dementia, which is caused by little strokes or blockages in the blood vessels in the brain. We'll talk about that as well, as we're talking about how blood vessel health affects our brain health. Frontotemporal dementia usually is more early onset and affecting behavior or language. Parkinson's disease dementia. And then there's even a newer one that we just learned about, this protein called TDP-43. They call the condition late for short, because you can see it's a mouthful there. But what this is a condition that looks like Alzheimer's disease in the person, but when you look in the person's brain, it's a different kind of protein buildup. And sometimes people don't even have amyloid buildup. So that can be confusing, especially with amyloid scans available and amyloid blood tests and spinal fluid, which I think you heard from Dr. Johnson, and we'll talk a little bit about. But again, we might not have amyloid in our brain, and it might be this other condition, but we don't have great markers for that yet. So that's something we're working on. So when we say somebody has vascular dementia, again, what that usually implies is that they've had a stroke, and that it shows up on the brain scan and by history. So for example, I had a patient once who he'd been working part-time at his job and living alone. His sister had talked to him. And then one day when she talked to him on the phone, she noticed he wasn't speaking as clearly. He wasn't, just he seemed more confused. He wasn't doing his job very well. And this had happened since the last few weeks ago when she had seen him, and it turned out he had had numerous little small strokes that had contributed to him having some mild cognitive impairment. So again, this is a little different than some of the blood vessel changes we'll be talking about related to Alzheimer's disease, because this is something that happens quickly and kind of points to a stroke causing those symptoms. So people can have both. You can have vascular dementia and Alzheimer's disease. That's why on that picture I showed previously here, there's a big part of when we think about how many people have different kinds of dementia, there's a lot of people who have mixed causes. So it can be a mix of Alzheimer's and vascular, Alzheimer's and Lewy body. So there's really not such a thing as pure Alzheimer's dementia, because usually we have other stuff going on. So again, vascular dementia is different than Alzheimer's, but these vascular risk factors can really occur commonly together. And so how common is that? And so I'm going to show now, this is a graph from a bunch of studies looking at brain samples. This is some colleagues from Rush University in Chicago area. And what each of these lines show are that the purple line on the bottom here is, and this is the chance of Alzheimer's disease dementia over time if you have no blood vessel disease. So if you're the purple line on the bottom, you don't have any strokes, no changes to the blood vessels. The second line, and these are just kind of specific terms they have, but the second blue line is if they've had strokes before. The line that's green shows if they've had larger strokes and the mini strokes. And then again, it kind of increases the orangish reddish line is if they've had not only big strokes, mini strokes, and extra kind of thickening of the blood vessels. And then the top one is all kinds of blood vessel changes. So you can see, and this is the risk of Alzheimer's disease dementia. So this isn't for having just vascular dementia, but it's a risk of having Alzheimer's disease dementia. So the risk of having that amyloid and tau buildup as well. So you can see that the more blood vessel damage we have over time, the greater our chances are of having Alzheimer's disease. And how does this work? So how do these blood vessel risk factors contribute to dementia? So again, now we're still thinking about what's going on in that tissue in the brain. So the nerve cells in the brain. So how do these affect dementia? So we know that if people have vascular risk factors, it narrows their blood vessels, and so it reduces blood flow. It can also weaken our artery walls. So we'll talk about that next, but this picture, oops, what am I doing here? I'm looking at are you guys seeing a bunch of scribbles?
I am, and I don't know how they're getting there.
I must have pressed, oh, how long have those been on there? I just noticed that over there.
They just started showing up, so I don't know.
I think those are I probably pressed something to annotate. I wonder if I can make those go away. Well, I'm not trying to scribble across. I think here, somehow I clicked the annotation. Let's try eraser. Aha, we have an eraser here. All right, here we go.
We're providing some cognitively stimulating activity inside of your presentation, Cynthia.
I was trying to keep looking at the camera, and then I was like, scribbled all over my pictures. All right, but that keeps me on my toes too. So that'll teach me to use my mouse without looking at it, right? So again, if you look at this picture up here, you can see that there's like a little bit of the blood vessels got weakened, and there are little tiny microbleeds there, which can happen in Alzheimer's disease because that amyloid can get into the blood vessel walls and make the blood vessels weaker. And that's tied to some of the side effects we see with some of these newer therapies that are out. We can also, by having lower blood flow in the brain, and also because we're really dependent on our brain's blood flow to clear out the toxins and to kind of bring nutrients to the brain, it can affect that. So if it's lower blood flow, we're just not clearing out the toxins and bringing the nutrients in the same way. And also it can cause those strokes like we talked about. So there are a variety of ways, again, the low blood flow, the little tiny bleeding, the strokes, all these things together can affect our brain health. So this is a little bit more about these microbleeds. So when we have Alzheimer's disease in our brain, it can cause these little tiny dots of bleeding because the blood vessel gets weakened, especially when the blood vessel splits. So when it splits into two, that connection point has a little bit of, can have a little bit of bleeding there. So that's something called amyloid angiopathy. And some of you on the call who have Alzheimer's disease, either mild cognitive impairment or dementia, might have amyloid angiopathy or been told by your doctor you have this. And this can show up on even like an MRI scan, like a regular one you'd get in the clinic. So that's something that might go along with Alzheimer's. And this gets to, I know someone had asked in the questions submitted before this talk, what are white matter changes? So we talked a little bit about how the gray matter, the little gray cells, and outside of the brain, that's where these purple kind of big bodies of the nerve cells are, neurons. And then the connection tracks are connected by these long strands. And the strands are coated with a cholesterol, which makes them look white. So this is, and it's called this myelin sheath. It's a kind of cholesterol that kind of bathes it. And that's why this tissue looks whiter on the scan. And so it's kind of like, and this is where you have to give me a break because I'm not an electrician, but I just know that you're not supposed to take the white coating off those because you can get shocked. So that's the extent of my electrician knowledge. So those electricians on the call, please forgive me. But anyway, so it's again, it's kind of similar to having the sheath over the electrical wires so that the brain can connect those signals more effectively. So when we have white matter changes, there's some low blood flow to some of these areas where this white coating is, and that white coating gets degraded, and then it looks like these little it shows up in the MRI scans. You see these little spots, and it makes the nerves not conduct their signals as well because of this loss of a coating. And so when we go to clinic, so if you go to your doctor, chances are that you've had either a CAT scan or an MRI scan if you have memory changes. And what those CAT scans and MRI scans show, they can show atrophy like we showed in the other scans. You can show shrinkage of that part of the brain. They can show if there's a tumor. So sometimes they'll find things like meningiomas, which are benign tumors that sometimes don't bother people their whole lives. You can see if there's any little bleeding. So those little dots, like we talked about, like the amyloid angiopathy. And then you can see if there's any strokes or damage to these connecting fibers. So in this picture here, you can see that there's a little bit of white changes here. And so the brain scan, you can see the white matter tracks actually look pretty dark here. This is a picture as if you're looking down on top of someone's head. The sections in the middle, the butterfly looking black area is just where spinal fluid is. That's normal. And then the in this picture, the gray matter looks more like lighter gray, and then the white matter is like this darker. You can see in the second picture and the third one, there's a lot more what we call white matter changes. So for people who are told they have white matter disease or small vessel ischemic disease, that's what this is that the tiny blood vessels have become blocked or narrowed, and they're impacting those the coating on the nerve cells. And so sometimes that can make people's thinking slower. It doesn't always affect memory, but a lot of times it's associated with just slower thinking. You know, you may not be able to think as quickly as you used to. So I think when you had Dr. Johnson speak, he probably talked about a lot of the new biomarkers for Alzheimer's disease. So, you know, again, I showed you just now, the typical brain scan that we do in clinic for decades and decades is either a CAT scan or an MRI scan. And so those can show, again, the atrophy, some of the little microbleeds, the dots. It can show the white matter changes, but it can't show us amyloid or tau or blood flow or anything like that. So in our thankfully, in the last about 10, 15 years, we've had this PET scan tool where now we can actually measure how much amyloid is in someone's brain. So for a long time, we've had spinal fluid tests. And I know I saw in the comments before, there are a few people on the call who've had lumbar punctures with me now or in the past. So again, spinal fluid can show us all kinds of things about the brain health. It can show us if somebody has amyloid and tau and inflammation, and now we're looking at some of those other protein buildups, the alpha-synuclein and TDP-43 and all of these. So spinal fluid still is very valuable for us to try to figure out what's going on in the brain. But these PET scans are nice because you can see, this is a picture of a PET scanner, and then you can see pictured here, this is again a scan as if you're looking down from on top of someone's head, so that butterfly looking area in the middle is where the spinal fluid is. But you can see in a person without Alzheimer's that their tissue is blue, which means that it lights up as blue, which means there's hardly any amyloid there. And the picture on the right shows where the red areas are, the warmer colors, that there's more amyloid buildup there. So with these scans, again, each one has to be done separately depending on what you want to look at. So if you want to look at amyloid, they inject a tracer into your arm, let it circulate, and it sticks to amyloid, and they take pictures. We now have ones that can look at tau also, so they have to do a separate scan. They inject a tau tracer, circulates in your system, and then it'll light up and show if you have tau in your brain. So now why that's helpful is because now we can piece together blood vessel changes and the amyloid and tau changes. But again, we still are working on trying to get better pictures and biomarker tests for these other types of dementias, because we know that Alzheimer's is not usually operating by itself. And the exciting part is that now we have blood tests, because as much as I like doing lumbar punctures, I'm sure all of you would love to have a lumbar puncture with me. It's so much easier to have a blood test, and that can be, so we, again, we have good blood tests now for amyloid and tau, which is wonderful. We just don't have good blood tests for the other kinds of dementia, which we're working on. The other thing that we're working on with our research team is that we're able to look at blood flow. So not just those dots showing old bleeding or the dots showing old low blood flow to those tracts in the brain, but our team here, we work with a group of people who are called medical physicists, and they are able to develop certain scans that can show us what someone's blood flow is. And so they call it 4-dimensional flow, because not only can they do a 3-dimensional picture, so even though I don't have a cool rotating brain, which I should add to this, I'm always nervous about having videos embedded into things, but it can show you a 3-dimensional brain, and it can show you the blood flow across there. So not only is it 3-dimensional, but it shows you how quickly the blood is flowing through these different blood vessel segments. And then you can see here a PET scan showing amyloid buildup. You can piece that together with the blood flow shown in these other specialized MRI scans that our medical physicist colleagues have developed. And what the picture on the left shows is that for each of these sections of bars, those are different types of blood vessels in the brain. And the more cognitive impairment someone has, so if the person's living with Alzheimer's disease, the person's living with mild cognitive impairment, they have the darker bars. So you can see that across these different blood vessels in the brain, that their blood flows tends to be lower. And so if somebody's doesn't have Alzheimer's, their blood flow is higher. So what we're trying to figure out, well, is that if we improve blood flow, does that help people think better? That's where our hopes are. So that's a lot of the research we're doing too, is to see, can we help improve blood flow to the brain and see if that'll help our thinking abilities. There is a chance it could be, if this amyloid sets up shop first and then impacts the blood flow, then we need to target the amyloid first. If it's the blood flow contributing to amyloid, then we can target the blood flow and blood vessel risk factors. I think it's probably a little bit of both. So that's why we're targeting both our research. Okay, so we're almost to our Q&A session and break, but I'm just going to point out a few more things here. So we've talked a lot about what changes we see in the brain, so on the brain scans and the pictures. But again, what we care about as individuals, as humans, are how does this affect my thinking abilities, my ability to interact with my family, my loved ones, do the things I like to do. And so what this study showed is they looked at 4 blood vessel risk factors. They're listed over here: high blood pressure, diabetes, high cholesterol, and smoking. And so they said, well, how is our risk for dementia modified if we kind of stack all these things up? So you can see this just shows that the more blood vessel risk factors we have, the higher our risk is of getting dementia in later life. So again, this is for people in midlife and their risk for dementia in later life. So for those on the call who maybe aren't living with dementia, but maybe have a parent or family member with that, working on those blood vessel risk factors now could impact your risk. But it's never too late. We're finding from studies that you can start working on diet and exercise and things, even when you have some memory symptoms, and it can still be helpful. So again, trying to encourage you that it's good to start in midlife if you can. If you're beyond midlife, that's okay. There's still some benefit to addressing each of these risk factors. One other thing I also like to slip in here is sleep apnea. So obstructive sleep apnea is a condition where the tissue in the back of our throat tends to close off at night. Sometimes we'll have snoring or kind of snorting to become awake again. And it's treated by a mask called a CPAP mask or BiPAP mask that can go over the nose and mouth and helps kind of keep that airway open. And the reason it affects our memory is because it lowers the oxygen level to our brain at night. And it also puts extra stress on our heart and our blood vessel risk factors. So this picture just shows that not only does sleep apnea cause low oxygen, makes us sleepy, breaks up our sleep, fragments it, but it also, you can see over here, a lot of it impacts all these blood vessel risk factors. And so that changes amyloid levels and leads to thinking changes. So you can see over here, there's changes in diabetes, et cetera. So just another plug for those of you who may have sleep apnea, maybe struggling with your CPAP mask. There's all kinds of new masks and types and troubleshooting. So I encourage you to, if you've been told you have sleep apnea, to work with your respiratory therapist and try to get a mask that works for you. If you're not sure if you do, or if you think your partner might have some sleep apnea, again, it's good for our brain health if we get that treated, because it affects our blood vessel risk factors and our brain health. All right, and so my second to last slide here before our break and our Q&A time is this, again, when we think about how do these blood vessel risk factors, again, affect our thinking. So we've talked again about how it affects the pictures in the brain, the MRI scans, et cetera. And we've shown that this study showed that if you add up all these blood vessel risk factors, it increases our risk. But it also interacts with amyloid buildup. So this is a study done by our colleague Lindsay Clark and our team here, and it uses the Wisconsin Registry for Alzheimer's Prevention. And so some of you may be part of that study. And so this was a sub-study, had over 200 people who don't have cognitive impairment. They're ages 40 to 70. And they had 3 thinking tests over many years. And then they had some way, either a spinal fluid test or a PET scan, to see how much amyloid was built up in their brain. And so that, again, that's a picture of the PET scan might look like. And so what this is, the AB stands for amyloid, beta amyloid. And then the risk factor means whether or not they had a risk factor. So the green down here shows that if you have amyloid and the risk factor, so the risk factors we're showing here, high blood pressure or hypertension, and then obesity, you can see that over time, people declined more rapidly if they had both of those together. But even if you had, if you have amyloid and don't have that risk factor, again, that line is not as strong. So again, that's just another encouragement that if we make some changes in our blood vessel risk factors, even if we have amyloid, that may help our brain health and stave off some of those symptoms. So I'm going to summarize here, and then we'll see if we want to do Q&A now before our stretch break. But again, so far we've talked about the blood vessel risk factors in midlife, increase our risk of dementia later in life. So another plug for those of us who have blood vessel risk factors to address them. We'll talk about that after our break. Blood vessel damage can impact brain health in a variety of ways. So the mini strokes, the white matter tracts affected, mini bleeds, and then low blood flow, again, clearing out of toxins. And then blood vessel risk factors interact with amyloid, so that increases our risk, but it also means that it gives us a chance to do something about our risk by addressing these. So after the break, we're going to talk about what we can do to protect our brain, and the answers are in these 2 pictures. So we'll come back to that, but if you study these pictures, I don't really have a quiz, but you'll get that right. So I'm going to pause here and stop sharing and see what questions we have.
Thank you, Dr. Carlsson, for that great part one of your presentation. I'm really sitting here thinking about the value of exercise. I know we talk a lot about it, but like when it is specific to blood flow, can you just like help us like see a picture of how much blood or oxygen, or like what is it that our brain needs in order to just simply function, and how does exercise actually contribute to the health of our brain?
That's a great question, and there are a lot of ways, especially exercise helps affect our brain health. One is that it helps our over time, it gives our heart, it'll help our heart with better pump function. It can help lower some of the blood vessel risk factors. So exercise can help lower our blood pressure, can help bring our weight down, can help our blood sugars improve. So it affects those things that we might call like metabolic changes. But it also helps to make our blood vessels more elastic. So when when blood vessels are more elastic, they get better blood flow throughout the brain. So they're able to kind of expand and retract better. When they're stiff, then it causes more pressure back up on the heart, and it just kind of adds to the stiffness of the blood vessels, and over time they narrow over time. So it's a pretty dynamic process that exercise gradually increases. So it affects the blood vessel risk factors. It helps with how elastic the blood vessels are in the brain and throughout the body. And it helps with that blood flow as well. So I know it's kind of a big picture overview of how it works, but again, exercise is one that's been shown, and I'll mention this in the second part too, but there was a big study done by Christine Yaffe from San Francisco, and it was called Women Who Walk, and they found out that it's never too late to start walking, that if you whenever you start, whatever age you are, it's going to offer benefit. No matter, obviously you should check with your physician and make sure that there's no other complications or things that you need to think about with your walking. But again, they found that it wasn't too late. If you were younger, you had benefit. If you were older, you had benefit as well. So.
Great, thank you. Do we have questions from any of our satellite locations, or those of you taking part from your homes? Any questions? You can unmute yourself or put them in the chat.
We do have a question here in Green Bay, and I think it might be easier for us to just say it. So we have a question regarding cholesterol and stats. Statins,
Yeah.
there's some research that says that it causes dementia. Statins cause dementia, and cholesterol can be good for you, but others say you have to reduce the cholesterol. How do you argue for that, for those that?
Great question, and we get that a lot because so actually I do research on statins, and they have never found that statins have any negative effect on the brain. They, like in the big studies, all of us are individuals though, and so how we respond to a medication might be unique from what other people experience. So there was like a large study called the Heart Protection Study decades ago that had 20,000 people, and they looked at cognitive function at the end of it. They didn't measure at the beginning, but didn't find any negative effect of statins in that population. And really, the studies show that because statins have protection, they actually protect the blood vessels in the brain and in the heart, because they make them less likely to form those plaques build up. They make the blood vessels more elastic, so that kind of stretchiness is actually healthy for the brain. But word has gotten out, because I think the FDA put a warning on statins, and a colleague of mine, a mentor of mine, who was actually head of the committee that makes these recommendations, he was frustrated that they were going to put that label on there, because he's like, there's not good data. But again, each person is different. So I believe the people who've said, I started a statin and I had memory changes afterwards. But when you look at the vast majority of people, are going to have benefits from statins if it's indicated for their heart health. So again, even though I do research on statins and I'm not paid by any statin companies, even though I do research on statins, I wouldn't put a patient on a statin for only their brain health. It would be as if they meet criteria based on standard cardiovascular disease recommendations. So, but if you're on a statin and you're afraid you want to stop it because you're afraid it's going to affect your memory, I would say do not do that. If my own family members are on statins and I'm like, please stay on it, because the evidence for statins to protect our heart and our brain is excellent. And some people can't tolerate them because they have muscle cramps, but again, that's one question we get a lot, is the question about statins. Do they have negative effects on memory? And I would say no, they don't, for the vast majority of people.
Thank you, Dr. Carlsson. We have some questions coming in through the chat. So I'll start with the first one here.
Yeah.
Why, when you are exercising, do the instructors tell you to stop and breathe in and out? Does that have to do with your heart health?
That is a great question. I think a lot of that is probably more focused on mindfulness and trying to get us to relax. But it's also, the better we take deep inspirations, the better our oxygen exchanges in our lungs. Because if we tend to breathe real shallowly, then we're not getting as much oxygen as our lungs can take in. So I think they're probably doing a few things with that. One is to make sure we're taking deep breaths, which gives more oxygen exchange in our lungs. So there's more, the lungs are getting fuller and there's more contact to improve oxygen exchange, but also it also helps us to relax some and to reduce our stress by taking some nice deep breaths. So I think that's probably why most exercise teams would recommend that.
Another question.
Yeah, so the primary progressive aphasia. So thank you for bringing that up. This talk has focused. So the question is, on the first graph you showed, where mild cognitive impairment before dementia due to Alzheimer's, this progression, wondering where primary progressive aphasia would fall. So primary progressive aphasia is a condition that's kind of a subgroup of frontotemporal dementia, and it can be caused by different kinds of protein buildup. And so this is another condition where, and actually this is probably what my grandmother had, it was primary progressive aphasia. So it's one of two types of frontotemporal dementia. You have the behavior type where people have different changes in their personality, and then the primary progressive aphasia where it's focused mainly on language. So a lot of what determines what kind of changes we note in someone is what the protein is that's building up and then where in the brain it happens. So in the frontotemporal dementia, if it's in the frontal lobe or the front part of the brain, then that's more behavior. If it's in the temporal or outside side parts of the brain, then that part tends to be more of where language centers are in their brain. So I talked about Alzheimer's, kind of more of the typical general where someone has gradually progressive memory changes or quickness of thinking or some language. If it's primary progressive aphasia, that mild cognitive impairment might look different. That mild cognitive impairment might be trouble finding the right words to say, or having someone kind of step in and substitute words for you, or describing around a word until you can come up with that word itself. So that what we see in the person changes, but primary progressive aphasia can be from a variety of different types of protein buildup. So it could be like the amyloid and tau, it could be some other this TDP-43 protein. It can be a variety of types. So so I kind of use that as kind of a general picture, but primary progressive aphasia can be on that curve as well.
Then we have one more question. Oh, we might have two more questions, and then we'll take our break. Why do you hear the word movement more than exercise when talking about improving health?
So that's a great question. So movement, I think people are moving more toward the word move, because moving is something we can all do. I can stand at my desk here, I can stand up I have physical therapy exercises I have to do. So I do those sometimes standing here at my desk, because that's movement. I can march in place here at my desk. I can wave my arms to get my light to come back on. So all these things, this movement is good for us. So it's a step in the right direction, where I think some of us get intimidated by the term exercise, where we think, well, I can't exercise. I've got a bum hip, or I can't exercise because I have to use a walker now. But there's all kinds of ways for us to improve our movement. And so I think they're trying to make, think there's a move toward that, because they're trying to realize that, exercise really is for everyone. We can all start moving more. And so that's why that I mentioned that article where they found that it's never too late to start walking, because for a lot of types of activities, like if I can't walk, if I'm in a walker or in a wheelchair, I can still do arm exercises maybe, or, so each person is going to be different what they're able to do. But the main thing is to get our bodies moving, to get our heart rate up, to get that blood flowing. So, finding something you like for me, for me to have to drive somewhere to an exercise place in the winter, I don't want to do it. But there's a exercise studio down the street for me, and I can walk to that, and I like that. And so that's something I can stick with. Whereas if I have to drive to a big gym across town or something to do that, I'm probably not going to do that. So finding something you like and it's feasible, that helps you move more, it's enjoyable, is really important part of that. All right, and then the last question I think is there any data confirming data on the effectiveness of either nutritional supplements or vitamins that can affect brain health? So there's a lot of research in this area. And one of the biggest questions we get, which I'm just going to head off the path here, we can talk about it more later too, but it's about Prevagen. So Prevagen has some good theory behind it. It's this receptor that is related to brain health. They do an extract from jellyfish in this aquaporin, I think. They do this extract from jellyfish to make Prevagen. But I just double checked again last night, and Prevagen's been accused of fraud by the FDA. The state of New York just won a lawsuit against them because they are making claims about their product that are not true. It costs between $40 to $90 a month or so. And we'll talk about ways that we can use, that all of us could use that money towards something else that's more helpful for our brains in the next section. But so that's just on Prevagen. The other health supplements, they're being studied. So they're studies at NIH. We're actually later on today, we're going to have a meeting about a nutritional supplement study that we might do here at Wisconsin. So there's a lot of different things we're looking at, but there's no evidence so far that any of the nutritional supplements are helpful for. So resveratrol, all these ones you see, these combination brain health, there's no evidence that they're helpful. So if you want to take something, please talk to your physician about, because there's some over-the-counter herbal therapies that can be actually damaging if they interact with your medicines. But then there's some like vitamin B12. If your level is low, you should take a supplement. If your vitamin D level is low or any of your vitamins are low, then supplements to get that back up to a good level makes sense. But taking a lot of extra supplements doesn't have any evidence behind it yet. But being a part of studies or coming to talks like this where we will share with you as these studies get published, then we'll share with you, because we would love for supplements to kind of be added to our options to help people keep their brain healthy. Mushrooms.
Great. Do you
All
want to
right,
take one
mushrooms
more
is,
question before
yeah, so
we
there's
go to the break?
psychedelic mushrooms. There's research being done on that. I'm not recommending mushrooms right now, other than the kind you cook in your food. But there are some, there's a lot of research being done on these mushrooms that can help with either mental health disorders or can they reset people's thinking abilities. So we don't have evidence yet, but that's being studied though.
Good morning. I think I came at a really exciting time. When I read mushrooms, I actually assumed it just meant like regular reishi mushrooms, and I didn't know that they were referring to the psychedelic. I am reading or just finishing. I should be more clear. I don't read anymore. I listen to books, and I'm finishing Michael Pollan's book, How to Change Your Mind. And he talks about psilocybin and LSD from the research, neuroscientific, and then, of course, the cultural aspect of it. And so it's a very, there is more and more research looking at psychedelics. We aren't doing any of that in Wisconsin, to my.
We are actually. There's
Oh, we
some
are?
for there's a lab looking at it for, I think, for mental health reasons. But yeah, there's a lab here
That's
looking.
that's incredible. I hope they put out some publications soon. It is, yeah, it's an interesting field. Now they're not actually using mushrooms, right? They're actually synthesizing it in a lab, and then it is different. 'Cause I think those things are, but it's fascinating. The field is fascinating.
I think I'm just going to stick with the mushrooms that I can put in my sauces
Yeah.
and
Maybe
on
Bella.
my
Yeah.
burgers and stuff.
So now the spoilers, you saw the spoilers. So we're going to talk now about what can we do to protect our brains. So again, we talked about kind of more of the background information. So how do blood vessels interact with Alzheimer's? So again, it impacts the blood flow to our brain, the nutrients. It can impact the oxygen delivery to our brain, can cause some strokes affecting those tracks. But now let's talk a little bit more in detail about what are types of therapies that target these vascular risk factors, how that can change cognitive decline and dementia, and then what can we do individually to improve our vascular and brain health? So again, coming back to our icebreaker question about goals we have for ourselves. So this is just some a summary that Lancet had this commission in 2020 that looked at prevention, intervention, and care. And what's notable about this is that they picked out these 12 modifiable risk factors. And they said that these 12 modifiable risk factors, a lot of which, the ones highlighted in red, are these blood vessel risk factors, account for about 40% of dementias worldwide. So think about that. If we control these vascular risk factors and these other modifiable ones, which are related, we could maybe reduce the number of people with dementia by 40%, or at least stave off the onset of dementia. So that's pretty powerful. I mean, this should be a good motivator for us, and again, to make some differences in our lives individually to see if we can help address some of these risks that we have. So, so there have been some studies that have tried to see, well, let's see, can we kind of do a study where we combine all these factors together, including blood vessel risk factors, and see if that'll help with our thinking abilities. So there's a group in Finland that called it, and they had the Finnish geriatric study, so they called it the FINGER study, to prevent cognitive impairment. And it was a 2-year study. It had over 1,200 adults who were ages 60 to 77, and they did a multi-domain intervention. So a variety of interventions that affected different spheres of our life. So they had diet intervention, exercise, cognitive training, vascular risk modification. And they found that by addressing all these things, that it did improve cognitive performance. Well, the problem is that in Finland, they don't have Wisconsin cheese curds or fried fish on Fridays. And so people in different parts of the world were like, well, we're not Finns. We're, some of us in the call may be Finnish, but again, because the Finnish people have such a different diet and lifestyle than we might have in the States or in Latin America or other places, they started this program called the Worldwide Fingers. And so again, this Finnish geriatrics is why it's called Fingers. And so the United States developed one called the US Pointer Study. So they picked, I guess, just one finger and put a point. But again, all these studies work together to see, can we look at these different lifestyle factors and study and see, do they work? Do they make a difference in our lifestyle? So then, so we can kind of set that up even from a public health perspective. So the US Pointer is still collecting data toward the end, but it's finished enrollment. And again, this is a 2-year study. It has over 2,000 adults, ages 60 to 79. They're from a variety of parts of the country. So some from Chicagoland area, some from Houston, out east. I think there's a California site as well, yes. And so they picked people who were not regular exercisers. So there are probably some of us in this call who think, I could qualify for that. Don't exercise regularly, maybe don't have a great diet, like not very much variety of fruits and vegetables and whole grains, and people with some risk factors for dementia. So family history, again, we mentioned there's some cultural groups of patients who are at higher risk, so African American, Latino, people who are a little bit older, people who had some mild elevations in their blood vessel risk factors. So they picked people, and then they're studying to see if we give a self-guided lifestyle intervention. So if we, they're saying if we give you a packet of information on health, how does that help change what you do for yourself? Versus if you go with a group of people to the YMCA and you have meetings with a nutritional counselor, and you do some cognitive exercises through an app, and you have health monitoring about your blood vessel risk factors, etc. And so basically, what the one on the left is kind of things that we all could do. We could look up what's good for our brains and try to implement that on our own, versus if we have a little bit of push, groups and going to the YMCA. So, and this study duration is going on for 2 years. These data are not finished yet or published yet. So this is one of the big studies we're going to be looking for to see if we make a difference in our lifestyle. Because again, a lot of us are within reach of a YMCA, maybe not everyone here, but we might be able to do a nutritional counseling. So again, this study will be really important, the US Pointer study, but the Finnish study showed good results so far. There's another study based in California with Dr. Yaffe. She's the one who did that Women Who Walk study that I mentioned. So again, they did kind of a similar approach. So they looked at a multi-domain. So again, targeting thinking abilities, vascular risk factors, exercise, etc. Alzheimer's risk reduction trial, or SMART trial. I would think that anyone would want to just join it because the name, right? So there are 172 older adults without dementia. And they did, again, 2 years of this personal risk reduction goal. So health coaching, nurses visits, health education. And they found they did with a composite cognitive score, means they kind of combine different thinking abilities. So memory, language, how quickly someone thinks, and then their risk factor score. So it did seem like it helped improve cognition, improve these risk factors. So again, these healthy lifestyles are gaining traction that they might make a difference in our thinking abilities. Well, a lot of us, again, I don't know about you all, but sometimes we just like to take a pill to help address that. And I don't want to exercise or change my diet or all those things. So there's studies for you too. So for us too, I guess, or might be in that category. So candidate drugs. So what they're trying to do is a lot of studies have looked at what we call repurposing drugs. So when drugs are approved by the FDA, they're for a certain purpose. So they might be for high blood pressure or high cholesterol or preventing cardiovascular disease or controlling blood sugar or preventing stroke. So they have to have studies that show what they were designed for, and that's what the FDA approves them for. But there's also, sometimes we'll find out that drugs have other effects we didn't intend or didn't know about until people started using them. So I think like Propecia is one was used for a hair growth, and it was originally for prostate, improving prostate size. And so there's all kinds of things they find out as a kind of a byproduct of a medication. So, and again, a lot of this is related to the blood vessel health that we've talked about. So there've been some studies looking at these different types of blood pressure medications. So there's a group of them called ARBs, or angiotensin receptor blockers, and some also called ACE inhibitors that are looked at, calcium channel blockers, some diuretic therapies, and then also therapies for diabetes mellitus. There's studies looking at different therapies that maybe could affect brain health as well. And then we've talked a little bit about statins already, and then fish oil. So again, these studies they look at these therapies, and usually what they'll do first is to see, do these types of therapies affect markers for Alzheimer's disease? So before they spend a lot of money to see, does it help improve thinking abilities, which takes usually years to study someone's thinking, they might check what we call biomarkers. They might see, does this medicine reduce how much amyloid someone has, or does it help improve blood flow in the brain, or does it modify how much tau they have, or does it, on these really hard thinking tests, does it help their thinking speed improve? So a lot of these therapies will start by targeting these biomarkers before they launch into the bigger studies. So there's this is a summary of kind of where we are right now that in these clinical trials. They've looked at a whole bunch of different blood vessel risk factors, and really the best evidence is for control of blood pressure. So even though I've done a lot of cholesterol research, the best evidence is for blood pressure. So control, and I'll talk a little bit about some of those studies, but again, if you take away one message from this talk today, controlling your blood pressure is extremely important. It's important for brain health. It's had lots of good data over the years. There's also some data that supports use of a Mediterranean diet and statins. So Mediterranean diet, as you probably know, is more of a green leafy vegetables, fish, whole grains, healthy fats like you find in nuts. So a lot of those types of food will be in also combined with another diet that's called the DASH diet, or dietary approaches to stop hypertension. So if you combine the Mediterranean diet with this DASH diet, which again is a lot of fresh fruits and vegetables, they developed this one called the MIND diet, which kind of brings those two ideas together. The original study showed an improvement with use of the MIND diet. The second one was not quite as robust, but again, a lot of these principles have other heart health benefits. So again, in a lot of our clinics, we'll recommend people consider the MIND diet, Mediterranean diet, kind of really trying to improve, again, green leafy vegetables, increasing fruits and vegetables in the diet, and focusing on lean meats if we choose to eat meat. Then again, there's good evidence for walking, and it's never too late to start, as we've talked about. But again, a lot of these studies are still in the phase where they're testing to see, does it kind of bump any of these blood vessel blood flow? Does it affect these amyloid markers? Does it help improve the thinking tests? And then the larger studies are needed to say, does it really help prevent Alzheimer's disease? So, so there's good evidence, especially for blood pressure, some for diet and statins, and then walking is also good evidence. So this is a study we did. This is a statin study we did with, and it was in people who are cognitively healthy. So older, middle-aged, older adults, people who are on a statin drug, so simvastatin in this case, versus placebo for 18 months. And what this study showed, all these cool colored lines here, showed that the statin drug helped improve those connection tracks that we talked about. So these pictures here are different ways to measure the health of those connection tracks between the nerve cells in the brain. And so Nick Vogt, who was a graduate student with Dr. Benlin, analyzed some data from one of our studies, one of my studies that looked at how does statin help improve these connection tracks. And so in this small study, it did show that there was some improvement in those measures of health. But again, does that translate into reduced risk for Alzheimer's disease? We don't know yet. We just completed this study called the BRAVE study, and this is a study that I did in veterans. So this is 131 veterans, so they're cognitively unimpaired, ages 50 to 75, and they were on for a year and a half a type of, it's not really a fish oil, but it's type of omega-3 fatty acid prescription medication called icosapent ethyl, or Vascepa is the trade name. And so we compared veterans on the Vascepa versus placebo. We were blinded to which ones they were taking. And then we looked at changes in blood flow and spinal fluid markers for amyloid, tau, and then these really hard thinking tests to see how quickly they're able to think. And our early results, we haven't finalized the data yet, but our early results showed it didn't really help our brain blood flow or these amyloid changes or the thinking abilities in this small group of veterans over this year and a half period of time. So does it mean that these types of omega-3 fatty acids don't help? Not necessarily, but it doesn't show that for sure they do. So we've got some more work to do to see how can we look and see are there other supplements or prescription therapies that we can use to help protect our brain health. What about diabetes medications? So this is what's called a systematic review, where they go through all the studies that have been published and using different diabetes medications. So these are some of the ones that have been studied. So intranasal insulin. So again, what that means is that it bypasses affecting our body's insulin levels, and it goes right into the brain because of the the way the brain's structured, it can get right into the brain tissue through the nose. You can see some of the other agents listed here. And a lot of them did make a difference on these Alzheimer's biomarkers in the imaging pictures. But again, what we really care about is, does it help prevent Alzheimer's, prevent mild cognitive impairment? And so those studies are still ongoing. So there's some promising medicines here that are listed. But again, the studies are still needed to see, for us to be able to say for sure, this would be good for you to take for your brain health. But this study, I think, is one of my favorite studies. So, so the Sprint Mind study was a study that looked at over 2,800 people who had average blood pressure readings, so about 130, which we, the top number, the systolic number, a lot of us would be like, that's not too bad. And they looked to see whether treating to a lower number, so that less than 120 compared to letting it just ride less than 140, reduced risk of getting dementia, mild cognitive impairment, or both combined. So again, these are people who didn't have cognitive impairment at baseline, and they were given a few different types of blood pressure medications. So things, a thiazide diuretic pill, so things like hydrochlorothiazide, or an ACE inhibitor like lisinopril, or an angiotensin receptor blocker like valsartan, or a calcium channel blocker like amlodipine or something. So again, they're given different combinations of blood pressure medicines. And then to see, does getting our blood pressure low to like that 120 versus just letting it be around less than 140, if that made a difference or not. So what they found, that by lowering blood pressure to that less than 120, that the new cases of mild cognitive impairment were reduced by 19%. And the combined outcome of mild cognitive impairment and dementia was reduced by 15%. So this study did show prospectively, this is a placebo-controlled study, to see that it looked like lowering our blood pressure below that 120 mark for our top number, the systolic. It seemed like it was helpful for improving our brain health. So some people were like, well, this isn't a positive study, didn't show it because not enough people were protected from getting dementia. But again, what we did find were that people with mild cognitive impairment and the combination of mild cognitive impairment and dementia was reduced. So to me, that looked favorable. And again, there's other studies too that support that controlling high blood pressure is a really good thing for our brain health. So that leads me to our last section about what can we do for ourselves. So, and these are again, I think I really want all of us to kind of take a moment and think about what we put in the chat when, Jen asked us our icebreaker question. And this, this gets me thinking about my own health as well. What do we know? Do I know all my numbers here? So do I know what my blood sugar level is? Do I know what my blood pressure is? Do I know what it's supposed to be? Do I know what my cholesterol level is? Do I know what my body mass index is? I think we don't like to talk about our body mass index because there's, it's not a matter of shaming for body weight. It's just a matter of trying to move into a healthy range for our body weight. So, and that ties in with the waistline too. So again, waistline measurements are really to help us because the fat that goes around our midsection is more dangerous for blood vessel health than the kind that goes on our hips. So again, just knowing our numbers and if we don't know our numbers, maybe to take some time to go into my chart or to ask our doctor, what was my last blood sugar? If you don't know your blood pressure reading, this is where I'd encourage you to think about getting a home blood pressure cuff and keep an eye on that and see. That'll help your doctor to help them know what's are your medicines working for you? Do you need new medicines? Maybe you need to exercise more, or maybe losing 5 pounds will help you see your blood pressure medicine works better. And then same with the cholesterol. Maybe, making some dietary changes, instead of eating chips when we come back from, in the afternoon, to have a bowl full of grapes or carrots or something that we, just making some small changes can help us move toward these goals. But again, knowing your numbers, there's been a big campaign about helping us, again, to take control of our health. And these are some numbers that if you don't know yours, I would encourage you to look them up or, get a piece of paper, write them down from your My Chart, and just kind of have some goals for yourself. And this ties into this the American Heart Association too has this Life's Essential 8. And again, some of them are related to vascular risk factors, some of them are beyond that as well, but they all kind of interrelate. So a healthy diet helps with our, following the DASH or Mediterranean diet, line diet, helps with controlling our weight and blood pressure and all these things. Physical activities we mentioned about. So again, moving more or being active as opposed to the word exercise, this was raised, even if we can't get right to 150 minutes a week, maybe setting, 10 minutes a week to start with, just something that's feasible. Glucose levels, healthy weight, looking at our blood lipids, blood pressure, trying to avoid smoking if we can. If we've stopped smoking, great, keep working on staying not smoking. If we haven't stopped smoking, to maybe think about seeking out help for that. And then getting good rest. So again, the good rest helps our brain to recover, kind of reset, clear out those toxins, etc. So if I had to pick one of all these 8 Life's Essential 8s, I would focus on our blood pressure. So if you want one thing to take home, it's blood pressure. And so, again, I know patients all the time will ask me about Prevagen and, and other supplements too that are pretty costly over time. But if, even if you used a couple months worth of Prevagen costs or other ones, I don't want to pick just on Prevagen. There's a lot of nutraceuticals out there that don't have evidence behind them. If you take a couple months worth of those therapies, the cost for those, and buy a blood pressure cuff for yourself, and or a nice pair of walking shoes. You can get a good pair of walking shoes for probably a couple months worth of the cost that some of these supplements cost. So thinking about how can I get a blood pressure cuff, keep an eye on my blood pressure, and get some walking shoes, or if you can't walk, if you have trouble walking, trying some other, maybe some small hand weights or something, 2-pound weights, just to do some arm exercises and get you moving. So thinking about what you could do that's tangible is good. And then what else can you do? So like I mentioned, our Alzheimer's Center, we do studies in all kinds of things. And, we have studies looking at statin drugs. We have studies looking again at fish oil. We have some other, supplement studies coming up. We have some, we've had exercise studies. We have gut health studies. So there's all kinds of studies that'll help us get answers. And again, that's where we share them back with you. Once we find the answers, we share them back. But again, the questions you ask, things you're interested in, actually also shapes our research. So there's also clinical trials in Alzheimer's disease. If you're not in Wisconsin, I know we have some people who are out of state. There's other clinical trials. All clinical trials have to post on this website. So if you're interested in a study or a certain area, look and see what's available in your region. And then the Alzheimer's Association Trial Match will also help you try to pair up with studies, and they'll identify if you have normal cognition or cognitively unimpaired, have some mild cognitive impairment or dementia. They'll help you find some studies that'll fit with where you are. So in summary, so again, our blood vessel risk factors in midlife, they contribute to the onset and progression of dementia later in life. So again, because they're modifiable, that's something we can do something about. Many dementias have mixed causes. So we've heard some about primary progressive aphasia today, but sometimes blood vessel risk factors are contributing to a lot of those. These multi-domain interventions, so ones where people are taking action for their healthy lifestyle, eating, they're walking, things like that, do seem to have some early evidence, and there's some bigger studies that'll be coming out soon. And then again, I think as far as targeted therapies, control of blood pressure has the best evidence so far, and that there's other studies that are underway to see if we control these blood vessel risk factors, how does it really impact our risk for development of dementia. So I'm going to stop there and see what questions we have.
There are a few questions. I think you.
Hi there, we have a question in the Green Bay.
I have a question. When you're on high blood pressure pills or any kind of statins and stuff like that, I was always told that those pills are like for the rest of your life. You don't have to take those for the rest of your life, do you? Or is there something that you can do to, like wean yourself off the pills? Once you lose the weight and eat right and all of that, is it necessary to take them for the rest of your life or what? for those that don't want to be on it for the rest of their life?
That's a great question. And it's mixed, because there are some people that if you were able to lose weight, let's say, sometimes that'll make your blood pressure go back to normal or your blood sugar go back to normal, and then you don't need to be on the medicines anymore. Or cholesterol, you change your diet, you stop eating as much fried food, and sometimes that does work. There are other people, though, I just had a patient in clinic yesterday who he's walking miles and miles a day, and they've been on the basically Mediterranean diet for years, and he said he was told he had really high cholesterol, and he kept doing this, and his cholesterol is still extremely high. And so he's on a high dose of a statin drug because that's probably more genetic. So each person's really different if that will impact, if we are able to wean ourselves off of those. And that goes the same thing for high blood pressure too. Sometimes, like I said, if we lose weight and exercise, sometimes we don't need to have the blood pressure medicines anymore. But sometimes we will need them, but just because of our genetics or the way our body's changing with aging. And like we saw, about 80% of us are going to have high blood pressure when we get in our 70s. So in those cases, a lot of times we'll need to be on blood pressure medicines long-term. But again, I think setting some healthy lifestyle goals and just talking with your doctor, can we see how much it comes down? Can I try cutting back this medicine, but just always do it in connection with what your clinician, your provider recommends. Because again, the evidence for these blood vessel risk factors preventing heart attacks and strokes are so strong. So I think that's really good. And then we're hoping that another benefit will be that it prevents Alzheimer's. And I see a question. I see, I don't know if we answered this one. So from before about, does fish oil help brain health? And again, that's the study that we did, that so far there have been several studies with fish oil. One looked at, there's two different types of fish oil. There's, they call it fish oil, but one's called DHA, and then one's EPA. And they kind of go, if you take a fish oil capsule, usually it's a mix of those two. And they did a study in people with dementia and gave them this DHA part of the fish oil, and that did not slow down progression of dementia. So that's why in our study, we used the EPA type, which is the other kind of part, and it didn't really show improvement in thinking abilities. Again, it doesn't necessarily mean that it doesn't improve your cardiovascular risks. So in the case of fish oil, I would talk again with your physician, because there's evidence for certain subgroups of people based on how your cholesterol looks, especially if you have high triglycerides, which are the type of blood fat, that they can help with that. So, work closely with your physician or your primary care provider on whether you should be on fish oil. Because it can thin the blood a little too. So you want to be careful you're not taking it without them knowing. And I don't know much about lion's mane mushrooms. I don't know, Dr. Chin, do you know much about lion's mane mushrooms? Nope. There's some buzz about it. Yeah. And I'm glad the more you bring this up, the more we look into it and see what studies are out there. So, has anyone else heard more about lion's mane or?
I have a question. This is Anne.
Yeah.
I read an article in Science that an experimental cancer drug appeared to re-energize the brains of mice that had a form of Alzheimer's and even restored their ability to learn and remember. They reported it eventually may be possible to reverse some of the symptoms of Alzheimer's in people by using drugs that break its brain metabolism. Have you heard about this?
I haven't heard much about that. I think you submitted that question ahead of time. I don't know much about that study yet. Nate, do you know much about that? Dr. Chin, do you know anything about that?
I don't. I've been told about the study, and one of the things that I think is really important to consider is, especially when there is a brain disease, you have to remove the brain disease or treat the brain disease, and then also then do a separate thing where you're trying to strengthen the brain, bring back brain cells at a cellular level, improve those neural networks that Dr. Carlsson talked about. And so the drug you're referring to and could be one that's that secondary step of, how else can we improve the ability of the brain? And I think those are really important. Mice studies, there's been a lot of really successful mice studies that have not been successful in human beings, but I think we need to continue that line of research so that we have as many options as possible. But I think of it as a two-step process of, if we do have brain disease, we still have to figure out how to address and treat the brain disease. And then we also have to figure out how to restore and bring back the vitality of our brain.
Okay, I wish they would have said what the cancer drug was, but they didn't say that. So
Yeah, I think I found it, and it's called this indolamine 2,3-dioxygenase 1. That's probably why they didn't mention it, but oh no, that's the enzyme level. Okay. All right, so that I think, yeah, so I think the cancer drug, what they're thinking is behind it, those protein clumps, so the amyloid protein clumps, as a consequence of that, this enzyme is released. That's what I just mentioned. And then I think that it kind of reduces those levels. But then there's always the balance of those enzymes have a function in our body. We want to make sure we're not quieting them down unnecessarily and having bad consequences from that too. So we'll keep looking into that. But yeah, I think what Dr. Chin said is really valuable. And I'm always encouraged by these new directions, but they always have to be tested to make sure that they're not by quieting them down, that we're not causing negative problems. Yeah.
Okay, I had just read that and I was very curious. So anyway, thank you.
Yeah, so the
We have another question here in Green Bay.
yes.
Does antidepressant pills affect the brain?
I'm sorry, can you repeat that?
Yeah, does antidepressant pills affect the brain?
That's a great question. So we know that depression is associated with risk for dementia, and that quite a few people, I think it's about a third or so people with dementia have some depressive symptoms. So, it would be natural to ask, do antidepressants like, this group called SSRIs that are commonly used, do they help reduce risk for dementia? I think we'll be finding out more of those answers soon. Our in Alzheimer's research are starting to pay more attention to those depressive symptoms. And so a lot of the new studies are going to be characterizing that better in the future. I think the hard part is that sometimes it's not clear if it's depression and then a memory problem, or is it the depression's kind of part of the memory problem, like part of the same process. So I think with newer changes to our research studies, I think we'll be able to tease that apart a little bit better, which will give us more answers about if we treat depression, does it help reduce our risk? I don't know if you want to add anything, Dr. Chin.
I just think mental health and cognition are so complicated and they're intertwined that it's going to be really hard for us to figure out the separate entities, because certainly at a neurochemical level, serotonin, dopamine, norepinephrine, those are related to mental health, but they're also related to cognitive ability too. And as Dr. Carlsson said, when we're not feeling like ourselves, certainly we perform differently on thinking tests and we feel differently. And so as a clinician, when people come in, that's a really good question. Well, will this medication harm me? But going without treatment, without care for mental health is also going to be harmful. So you never, usually we err on, let's try treatment and see how you feel, and we can always make that change. But it's never a very easy answer, and it's never, it's not a one size fits all. So I think it is really tricky, and I'm glad there are researchers on it, but I imagine that's really complicated to figure out.
Just a little plug, we had earlier this week, we had a session on loneliness and isolation and the effect of that on brain health. And so, even non-medical therapies for loneliness, depression, isolation can be extremely helpful for us. And so if you weren't able to attend that, I encourage you to It's gonna be online, Jen, I think that, yep. So I encourage you to watch that because it really was a good session. I can say that because I wasn't a speaker. So, but really, really nice session, really good questions people had. So
Yeah, I could put a link to that presentation in the follow-up email that I send out to everybody because I believe it's ready on YouTube already.
yes, I will share my slides. And then the question about type 3 diabetes, that is, so the question is, I've heard people call Alzheimer's dementia or vascular dementia type 3 diabetes. Is this an accurate description? Why would people make this conclusion? Are there thoughts on this? Again, there's, again, with diabetes, you can have, type 1 is the type that you need to have insulin. You're just not making enough insulin. And again, this is simplified, but type 2 is that you're making insulin, but it's just not effectively getting the glucose into the cells. And then type 3, again, people have described Alzheimer's disease as this type 3 diabetes, where there's abnormalities in how the brain's managing blood sugar and getting it into the brain to help with function. Again, it's a little bit confusing because it makes it sound like, well, then we need to treat the brain with some type of diabetic agent. But I think it's a little more complicated than that. So there's still a lot of people working on how do we understand how the brain uses blood sugar and how it processes energy, and how can we make sure that the brain gets the nutrients it needs. But again, it's not that is out there. They consider it type 3 diabetes. But there's still research that people are working on. So and related to that, the question about metformin may be a useful drug. There are some studies looking at metformin to see if it reduces a lot of different aspects of aging. Again, I would encourage you, if you do have diabetes, to talk with your primary care clinician to make sure that you are on an agent that's good for your type of diabetes and that agrees with you as far as side effects and kidney function and everything. And then studies on rapamycin. Rapamycin's been used in a lot of animal models for looking at anti-aging strategies. I don't know if there have been recent human studies. I don't know, Dr. Chin, if you know anything else about rapamycin. No, okay.
No.
But yeah, it's been used in a lot of animal models. So the next question is a common one that a lot of us will face in various situations. So the question is, my husband is diagnosed with cardiomyopathy and has been on medication reduces heart rate to the 40s and 50s for 18 years. Can such a low pulse affect brain health? And so cardiomyopathy is when your muscles kind of stretched out and your heart's not pumping as effectively. And with each of us, it's going to be a little different because in general, if our heart pumps quickly, it doesn't get as much blood pushed out because it's not having a chance to fill and get nice and full of blood. So what happens if somebody has a heart that's weakened, it might take a little bit more time for it to relax and fill up with blood. So when it does squeeze, it gets more blood out. And so if it goes too fast, it just doesn't squeezing as much blood as it could otherwise. So especially with cardiomyopathy, they like to have the blood, the heart rate slow down so that the heart has a chance to fill up with blood and squeeze more effectively. So that's why there's always a balance, and the cardiologist should be watching closely to see there's ways they can monitor what the best heart rate is for each person. So if anything, the slower heart rate will help with the blood flow and help with the blood flow to the brain, so that those things we talked about, so that'll help with the nourishment, the oxygen getting to the brain, because they're letting the heart get slow enough that it's filling up effectively and then squeezing as effectively. Whereas for some of us, that might be too slow because our heart's squeezing out completely. So again, that's where the cardiologist comes in to help kind of get to that right dosing and all.
Well, thank you everybody for the great questions. Thank you, Dr. Carlsson, for your really, this is a great presentation and really informative. And thank you for all the information on what research is showing. And as Dr. Carlsson said, if there's anything you take away from today's presentation, what is it? The best evidence is control of blood pressure. And so that's a really good takeaway for us today. I'd like, Allie, if you can, we're just about to time. And so I want to go through a few more slides that we have. If you do not know about the Aging and Disability Resource Centers that are available to all of us throughout Wisconsin, every county has one. And we've got on this side links to the specific counties that have host sites with us. And then if you are not in one of those counties, the dhs.wisconsin.gov/ADRC is the place where you could go to find a resource center in your county. And there are a lot of wonderful programs and services that are available to us through these counties. So I would encourage you to go onto these websites, look around, click on the different pages, and see if there's something in there that would be specific to something that would be helpful to you. One of the things that I think about, particularly with today's topic, is there are actually a lot of evidence-based programs that are available to us through Wisconsin, particularly through the Wisconsin Institute of Healthy Aging. And a lot of the counties have facilitators that are trained to run programs like physical activity for lifelong success, or it's called PALS for short. Stand up for your health, walk with ease. These are all evidence-based programs that would be really good for our heart health. And then there are also specific programs like diabetes prevention programs, healthy living with diabetes, healthy living with chronic pain, healthy living well with chronic conditions, which is one I'm very familiar with. And so there's lots of different programs that can help you get started. So you could go to your ADRC and see if those programs are being offered. I'll also send all of you a link to the webpage for the Wisconsin Institute for Healthy Aging, so you can see more about those classes and see if something speaks to you and you'd like to take them. Usually these are available at no cost for folks to take. Another thing that we didn't talk about as a way to kind of have some accountability, Dr. Carlsson, was I know health coaching was on one of your slides, but things like Noom, or there's one that I was interested in and took advantage of through one of my past employments called, I think it was called Omada, but they actually send you a blood pressure cuff and they send you a scale, and it's all like connected to this app, and you can see all this really great information about how you're doing with keeping track of your numbers. So that's some of those are other really great ways to take advantage of just resources that are available to us. So Aging and Disability Resource Centers, can't say enough about them, and I'd encourage you to check them out. Next slide, please. Senior centers, Madison Senior Center is one of our host site partners, and senior centers are a great way to stay connected and avoid social isolation and loneliness. So if you want to learn more about the Madison Senior Center, here's the link. We'll send it we'll send it to you in the handouts that we send out in my follow-up email. But counties all over Wisconsin, towns all over Wisconsin have senior centers, and it's a really great way to stay connected and active. Next slide, please. So our next program in the Healthy Living with MCI Education Series will be on Friday, December 13th at 9:30, and our guest presenter will be Dr. Pamela Souza from the School of Communication at Northwestern University. Dr. Souza will share information on how managing hearing loss can help your memory, and registration is open for this program, and Allie has put some of the links in our chat. So feel free to go on and register for that program. Our next slide. And if you haven't yet tuned in to hear the Dementia Matters podcast, I highly recommend doing so. I've listened to many of them. Dr. Chin has some great conversations with leading scientists and caregiving experts to bring listeners the latest in Alzheimer's disease news, research, and caregiver resources. You can find his current and past interviews at adrc.wisc.edu/dementia matters. Dr. Chin, would you like to just take a minute to share information about your latest interviews or ones that you have coming down the pipeline?
Well, I will say that we are trying our best to keep them to 20 to 30 minutes. We've gotten good feedback from our listeners that sometimes I can talk too much and get a little bit too long. So for those that have been listening, I promise we will get shorter. I do have a 2-part series coming out with Dr. Risa Sperling, who's a clinical trial neurologist. And she's talking about some of the clinical trials that Dr. Carlsson is a part of here in Wisconsin, as well as what it means to eventually prevent Alzheimer's disease, as well, and treat it. And so those are some that are coming out. And then we are having, I think, 2 remaining for this year that will be non-scientific, but dealing, really focusing on what it means to be a family member of someone living with the change, as well as caregiving support groups, in addition to the ones that Jen has mentioned. So stay tuned. We're trying to be broad, covering research, clinical issues, and support.
Thank you so much, Dr. Chin. Next slide, Allie. If you're looking for a way to stay connected and up to date on news and events happening at the Wisconsin Alzheimer's Disease Research Center, we would encourage you to consider subscribing to our center's e-news called Headlines, and Allie has put that link in the chat, and it's also on the slide. Next slide. If you're interested in learning more about research studies through the Wisconsin Alzheimer's Disease Research Center, you can visit our website to see which studies are recruiting volunteers and how to enroll in the ADRC recruitment registry. And you can find that by going to adrc.wisc.edu/volunteer study. And then we just want to conclude that as we close out today, we want to encourage you to please take a few minutes to fill out the surveys that will be coming to you as we close out the program today. And Allie, do you have the link? Could you put that in the chat for folks if they want to quick grab it? But this closes out our time together. We've had a really wonderful conversation about a really important topic. And we just want to thank all of you for taking part in today's program. And we look forward to seeing you again in December. So have a wonderful weekend. And we hope to see you again soon. And be well and take care.
Thank you, Jen. Really appreciate you leading this.
Thank you.